Welcome everybody to Women's Health Tech Wednesday. Today we have, I have the pleasure of introducing you to Malekeh Amini. Malekeh is a fairly amazing woman. She is the founder and CEO of Trayt, a healthcare software company dedicated to improving diagnostics and treatment for brain-based disorders, including autism, ADHD, depression, anxiety, substance abuse, and Alzheimer's, among other things. Prior to Trayt, Malekeh was Senior VP of Products and Business Development at Base Health, where she provided the vision connecting new breakthroughs in medical science to the needs of healthcare organizations and consumers. And a former consultant with the Boston Consulting Group and the Parthenon Group, Malekeh has provided strategic, operational, and fundraising advice to healthcare and education organizations globally. Malekeh served on the fundraising board of Baylor College of Medicine in Texas, and is currently a member of the board of directors of the Wings Learning Center in Redwood City. Malekeh has an MBA from Harvard University, and she earned her bachelor's degree in communication sciences, cognitive science, and computer science, and her master's in systems engineering at the University of Southern California. Myself, I have started a venture capital fund in digital healthcare, so AI and data-enabled diagnostics, and I'm very proud to have invested in Malekeh's company, and I'm super excited for have her tell you about it. So Malekeh, you want to just introduce yourself and say hello?
Hi, everyone. It's great to be here. As Michelle mentioned, I am founder and CEO of Trayt, and I started the company about 7 years ago, and really looking forward to our discussion this morning.
Great, thank you. I just want to underscore the critical nature of what Malekeh is really doing. If you look at the statistics, 51 million individuals suffer from mental health. 50% of adolescents alone struggle with mental health. And adolescent substance abuse is the #1 health problem in the US, which is unbelievable. $280 billion a year, according to the NIH, in annual costs, and over 90% failure for drugs in this area. So, inaccurate diagnosis over 30% of the time, a big problem, or misdiagnosis, 80% poor outcomes, right, with trial and error. So we felt this was just incredibly important area. This was an investment we made prior to COVID. I do believe that post-COVID, this problem has only exacerbated and has become literally a world health crisis. So I'm excited to talk to Malekeh and you learn a little bit about what she's doing today. So Malekeh, let's start with something very basic. So all entrepreneurs, they are inspired to come up with a solution because they find there's a problem. Tell me about your moment of inspiration, or what led you to develop Trayt.
So I actually, my background has been in healthcare for about 25 years, and I've been really involved with, as you mentioned, through Boston Consulting Group, and then continued on. And most of the work that I had been doing was in disease management, clinical definitions, things that are really tied to the disease themselves. And interestingly enough, in all the work that I was doing, there was always this gap in the brain disorders. We weren't developing disease management programs around them. We didn't have enough understanding of it. And over the years, I continue to see that is one of the remaining white spaces in healthcare in general. And then and I kind of knew that there was an opportunity. I identified a problem there, but really I saw the core of the issue when my own son was diagnosed with a number of different neurological issues. And one kept coming after another. We were running around going after different treatments. And every time he was on medication for one thing, something else would pop up. It continued to grow. And as I started to do some research into this, I realized that, his condition is not more complex than anybody else. These brain disorders are complex. They are always accompanied with other co-occurring conditions, with medical conditions, a huge impact from environmental factors. And none of those were considered in diagnosing my son or treating my son. How can it be that 100% of the time, these symptoms overlap and we still treat them? We know it's 100% of the time, but we still treat them as individual conditions and individual treatments. So that was the moment for me to actually say, you know what, I do want to be more hands-on involved and solve a real clinical problem.
I remember when you presented to us the first time, you were talking about the traditional descriptions were 6 categories, and the reality was there were so many more nuances and overlapping and comorbid conditions that for which the solutions, if you only treated it as a single condition, could actually end up having the opposite effect of helping the child, which was really impactful for me. I remember that.
Mhm.
So tell me a little bit about how you are solving this problem, because it's a big problem, right? You've got the science piece, you've got the comorbid elements, you've got the access to healthcare. How are you putting this all together in one solution to be effective and to really help our youth?
Right. So, like you said, this is a systemic challenge, right? There is a real science gap where, the symptoms that overlap with each other are common across many different diagnoses. And we're not able to diagnose. It makes it very hard to diagnose patients properly. So for us, for our company, really the foundation started there, is that if you solve the science problem, then you can address a lot of other issues in the systemic world of challenges. Clinical care is a challenge. It's still outdated and paper process. Access to care is not only that there's a shortage of behavioral services, but there's a real disparity now in who gets access. There are areas where the patient population is potentially at the highest risk, and there's zero availability of services. So all of these things combined are causing a much bigger problem. But the core of all of these issues could be addressed with proper diagnosis. And so the way we have actually addressed this is our foundation is a data platform. So we spent about 3 years of research with thought leading psychiatrists to really gather the core data that seems to be the bulk of these common overlapping symptoms. And for the first time, we've created a system that's not diagnosis driven, it's symptom driven. So you're not looking at patients as a Tourette syndrome or as a depressed, you actually look at them as a combination of different symptoms. And so what we've done is we've isolated those patterns of how patient symptoms overlap. And what we're working towards is actually a diagnostic model that uses those patterns to create a more accurate diagnosis, but also a more subtype diagnosis, so that every patient that's diagnosed with depression, none of them look the same. They're different comorbid symptoms. There are different aspects of the condition. So we're creating these patterns of subtyping, sort of similar to the foundation medicine of brain, right? So we're looking at it at a DNA level. What are the specific symptoms that overlap? What are the environmental factors? What's the genomic factor? Kind of use richer science and deeper insights in order to diagnose patients better. The current standard still, the gold standard remains the physician. There isn't a diagnostic that is being used today. So that's our initial, but the data platform itself has all of the algorithms built in to look at those patterns. And on top of that, we've currently created an application that sits in a clinical setting. So we sell to a psychiatry clinic. They have a clinician portal. And then there is, once we sell it to them and we enroll them, all of their patients automatically get, enrolled on our platform. Patients continue to monitor their symptoms, continue to communicate via their mobile app and their wearables, anything that they, Apple Watch, whatever they use in order to track certain things. And they communicate with each other. We've digitized the pen and paper model. So we've included all of the current standards into a digital platform. And and we have now a proprietary outcomes measures that's based on symptoms. Patients are continuously tracking. It's not every time you see a physician. And so, by sort of aligning the people who are closest to that data, we've managed to now gather significant amounts of information on how these comorbid symptoms, how these co-occurring conditions interact with each other. There is a real tailwind right now, as you mentioned, COVID, where there are dedicated funds, a lot of real governments, kind of legislative approach and commitment to solve the crisis that currently is going on. Suicide among adolescents has increased by 30%, or 300%, sorry. So what we've now created, so we're effectively going into psychiatry clinics, providing telemedicine and remote monitoring to the people who don't have access to services in order to intervene early. But because of the model that we have, which is measure the symptoms right at the beginning, we have our assessment now is a proprietary intake form that every psychiatry clinic that's our client is using. As they provide all of this collection of symptoms and of what they're experiencing, not just in the brain, but also medical, our patterns actually identify how this patient should be treated initially. And the data is available to clinicians real time. Right?
And that triaging you've done has had some amazing results, right?
It has. It's been, we've done it, some of our data is actually pretty interesting to us. We definitely have created a significantly more efficient workflow in clinical care. The information is digitized, they communicate real time. And so we've not only created 30% efficiency in the workflow itself, but because of the way we're tracking and because of the real-time nature of what we've created, we've actually been, from the data that we've received, probably, we have prevented at least 300 patients from not receiving care when they were suicidal. So potentially really, addressing 300 suicides. And one of the programs that we have is actually directly in, direct intervention in crisis management for adolescents. And that's, again, funded by the government. It's a funded program by Medicaid, in order to create remote access and early intervention in a way. Even though it's crisis management, they typically end up in a hospital. So we've averted 700 hospitalizations with just the past 3 months.
That's amazing.
It has been, some of our data has been really supporting what we initially founded the company on.
Yeah, that's amazing. Yeah, I think the impact is what struck me when we had those numbers, was the number of lives you actually intervene and save on the triaging model, which was really, just when you think about it, it's quite exciting to be part of that and developing that and creating that opportunity for those adolescents to really get treatment, because I find that, or I've seen over the years, that there's such a disparity in how these things are handled. And so and I also like the fact that you have created an intake ontology that is familiar for physicians. You're not trying to completely change how they do things, but you're working within their confines, and then you're bringing insights to them through data and through the perspectives. That was something also I really thought was great, was you have third-party input on your solution. Can you talk about that a little bit?
Yeah, so we have a, because we are a, kind of comprehensive multifactorial approach, naturally there are going to be different clinicians, for example, that are interacting with the patient, but these patients also have school counselors. There are teachers who are monitoring the symptoms of these patients. So it's significantly more than just one psychiatrist. And we have, through a digital central consent form, the parents provide for the children, or an adult can provide direct consent to actually have input from all of those sources into the application. So they don't need to subscribe to us, but they will have a link to submit data, so that a psychiatrist that's treating that patient is continuously aware of everybody else's treatments. These patients are on some really, really potent antipsychotics, and their management of those dosages and management of the types of therapies that they're receiving is going to be key. And if you're blind to that information, which today is the standard of care, you don't know what else is going on. You don't know what the teacher is seeing or the counselor is doing. So we've created something that actually allows for that type of data to be entered into the application, and all of it made available to the psychiatrist real time. And we also take, our intake also is threefold. The patient takes the intake, and both parents are completing the intake. So a lot of these, what a patient feels is not always what a parent sees. So that type of information is also provided to the clinician. So it really does make the conversation much richer
Yeah.
on that.
Yeah. I always found that was interesting, that in the past, the way things were done, there was almost a certain hostility to the getting the input from parents. It was almost like, I just want to talk to the child. I only want to hear from them. But when you think about it, mental health issues or challenges, a lot of them are really observational. And when you see one child for an hour every week or every other week, I can't imagine that it's not that it's easy to understand what's going on from one source. You might not, take all the input in the most objective manner. You may have differing opinions from parents and so forth. I imagine that's probably challenging, but I would imagine that a system that actually incorporates all of those third-party views are critical, because it's an ongoing observation, right?
It is. And every patient behaves, as you mentioned, it is observational, and every patient behaves differently in different settings. Every individual behaves differently in different settings. So observation in a clinic every 3 months is effectively giving zero information to a psychiatrist. And every time they ask, how is this medication working? It's a download of what happened last week, basically, right? No one remembers exactly what happened. They're not, the information is incomplete, basically. And there's no way you can get from observation and a 2-minute download a sense of whether your treatment, whether you've provided effective treatment, whether you should change anything, whether there are other things going on, other medications going on. There isn't that information at all available at an observation session.
Yeah. And all the medications they mostly fail, right, in this area. So it's a cocktail. Sometimes it's a trial and error system, which seems so inefficient and not at all accurate, right?
Absolutely. And it's also, when you look at kind of the options that a patient actually has at that point, there are multiple medications not managed properly right now, right? This is the standard of care today. So when you look at what happens, these patients either get stuck in this chronic loop of constantly adjusting treatments and constantly managing dosages. If in a good scenario, that's where they get stuck. Outcomes are not improving, right? So they keep getting stuck in this loop of chronic care, or unfortunately, at an significantly increasing rate, they end up in the emergency room and trying to address it in an ER or hospitalization. And sadly, I think, again, at a 300% escalation, they end up, with self-harm or harm to others, frankly. But that is exactly what happens. That is exactly what, there isn't a better path other than these three. The best one is to get stuck in this clinical loop of constantly trying to adjust some treatment so that, so they achieve some outcome. And as you said, it's 80% poor outcomes right now.
Yeah. And you have some amazing advisors and guiding you and helping you with this, in addition to your efforts, right? You've got
Definitely.
some really world-class talent there.
I do, definitely. And I think it's, for any company, we're a software company, not just we're a software company, but we actually are a solution company, as I was saying. But any company, whether it's a product or a solution or, a service, at the end of the day, your company is really going to be as good as the people around you are. And I've been really fortunate to have great team members, and thank you to Michele for bringing a few more really, really exciting and thought-leading individuals in their own fields, but multidisciplinary, that have really helped us move the company forward. And I think our mission, our advisors actually are really hands-on, as you know, and they are anywhere from building a product for us to really helping us grow as a company. And I think that that's a key element for any startup, given financial, limitations that we have and some of the challenges that we have in terms of having resources around the table all the time. Those advisors can really, really be an effective source for success, honestly.
Yeah. And now in Texas is interesting state and study, because they are really ahead when it comes to mental health with their adoption of your platform. So tell me a little bit about, real quickly, how that experience started and where it's gone now.
Yeah, it's, we initially, we launched our application as the first time deployment was at Texas Children's Hospital. And, interestingly enough, my own son was diagnosed there. But So we launched there, and it was effectively a pilot initially, but the Department of Psychiatry really quickly just completely deployed our application. So all of a sudden, 4,000 patients enrolled on the application and started to complete the intake form. And it became really a tool that they had to use in order to, achieve some of the things that they wanted to achieve. We had a competitor actually in Texas Children's who were also bidding on the same thing. And we actually took over that. So we won that award. From there, that's where kind of everything for us started. So it's such a great, startup story. We have a champion as a customer who really, really believed in the work we were doing. So once Texas started to put these programs together, and by the way, the programs themselves are now a national program, right? So it's a national initiative. Yes. But in Texas, what they did was kind of use Trayt to become a thought leading deployment of this national program. So there was an RFP to bid for providing these types of clinical remote monitoring and crisis management services, or even primary care integration into psychiatry care. And we put a bid there because we felt like we had an application that could actually do that as we were, without needing to build a product around it. A couple of our competitors again said, if Trayt is bidding, we won't bid, just because we did have a lower cost base in terms of deployment. And that's
how we were awarded. Solution.
Yeah. So we were awarded the program initially to provide primary care integration into psychiatry care, and then expanded. Texas immediately started to expand their programs on the Trayt application for crisis management through public school systems. And it now, we just actually last month were awarded one more contract from them to become now, and this is the dream for Trayt, to become the screening tool in public school settings for every adolescent. So effectively, the intake and the assessment will be available to 2.4 million patients or individuals. To monitor mental health. And then because we're a risk assessment platform and we're continuously monitoring this, as we see risk, we immediately connect them with the right program, whether it be, primary care or just general psychiatry or even crisis management before they even become symptomatic.
Yeah, it's a phenomenal fight. The one thing that I noticed was how you started with one program, and then the minute that they onboarded you and saw the value of what you're providing, everybody else. I mean, I think they suggested you apply for some of those additional contracts, if I'm not mistaken.
Yes,
so that's very exciting.
Yeah, and we've actually been able to backward integrate right now, right? So we've deployed this across all the institutions in Texas. And now we've become an application that keeps getting more and more from those individual clinics for use of Trayt in clinical care, day-to-day clinical care. So it's continued to grow.
Not to mention other states, right?
Yes. And we are now speaking to several other states with their programs. And again, doing the same thing where we go into academic institutions or health systems to deploy there for multiple programs. Yeah.
Fantastic. Yeah. So let me just one quick question about challenges you've had. So, there's being a female entrepreneur, it's like being a female venture capitalist, right? We're less than 2% out there, very hard. So it's no different as a female entrepreneur as I was previously. Can you talk just a little bit about the challenges you face both as a woman and then also just about being in Silicon Valley?
Yes, of course. So Silicon Valley fundraising is always and kind of the every startup's pain is always fundraising.
Yes.
But that's actually one of the main things honestly in Silicon Valley has been not every challenge is tied to being a woman. Right? There are multiple challenges for every startup in raising money, in operations, in having the ability to continuously grow successfully and become profitable as a company. Those are all tied to being a startup, but there are specific challenges that are tied to women. One of them is fundraising. It's much, much, much harder for a woman, especially a sole founder, which is where kind of I started, to raise money. And I think that's something that is obviously a known fact, but I definitely feel that. And then the other one, honestly, is that I'm really lucky to have you, Michele, on our board. because
Thank you.
the board management is another one. We tend to always have more men on our boards, and it becomes really difficult. I have to work 10 times harder. Before you joined, I had to work 10 times harder to really get my messages across, or to gain that level of credibility as I was speaking. And I think managing and having women on your board can really address that challenge.
Yeah.
Those to me are really the two areas that we feel the real issue of being a woman. But I also always tell, this is one of my belief systems also, is as I walk into a room, I no longer actually let myself feel that. I
Right.
always say that to all of my, I mentor a couple people, and have a lot of friends in this space, obviously. But I always say the same thing: don't ever walk into a room thinking you're a woman.
Right.
Walk into a room thinking that you are a successful, driven CEO
Entrepreneur.
raising money to solve a real world problem, and walk into the room feeling only that.
Yeah.
And it,
That's right.
and it does have, it does actually help in how we also present ourselves in those settings.
Yes. Yeah. Very true. Yeah. There was some studies that say that a lot of the questions for women revolve around your qualifications personally, and a lot of the questions that men would get are revolve around their solution and the opportunity. So you have to try and go beyond that and take that conversation to that next level, and not allow it to second guess yourself.
Exactly.
I think that's really important. Yeah. And that doesn't change whether you're an entrepreneur or whether you raise a venture fund.
Yeah,
I can tell you. So quick. So if I had to sum up, give me just sort of the high level. How would you describe Trayt if I was just going to sum it up in a sentence?
So, Trayt is effectively a personalized medicine approach to brain health. So as I was mentioning, similar to foundation medicine, for example, we're trying to really, really understand the science at a DNA level, if you can say that. And it literally is actually at a DNA level because of genomic data that currently is available now. But that is who we are. We are looking at personalized, really, really overlaps and patterns that identify at a molecular level, at a DNA level, what a patient's kind of profile looks like, and then address treatment at the same level, be personalized,
personalized
treatment.
Yeah.
Exactly. So it's just richer science, deeper insights.
That's so exciting.
In order to make clinical decisions more accurately.
Well, we're so excited to be part of your journey, and you have just exploded in the last year. So super excited to be supporting that journey for you and all the great work you're doing, Malekeh. Thank you for joining me today. I appreciate it. I'm going to just share real quick a couple of upcoming events for Hitlab. On April 7th, there's Ellen Lapointe, CEO of Fenway Health, is speaking. On April 14th, we have Elizabeth Bailey, Managing Director of RIA Ventures. On April 21st, Laura Haddock DiCarlo. April 28th, Linda Malik and Lisa Murtha from Moses and Singer. And May 5th, Missy Lavender of Renalis Health. Thank you so much for joining today. We enjoyed having you here and listening to some exciting news from Silicon Valley and from Digital DX Ventures on these incredible companies that are really changing the way healthcare is delivered into an incredibly effective and more personalized approach. So thank you, Malekeh. Appreciate your time.
Thank you so much, Michelle. Thanks, everybody.
Bye-bye.
Bye-bye.